Hi, I'm Dr. Miner. Today I am here with a patient that we are going to do a full face Botox treatment for. And today we are going to address the forehead, the 11s area, the crow's feet, around the nose, and we're even going to do a subtle lip enhancement with some Botox. So with this treatment today, we're also going to address what's called the temporalis muscle, which is up here. We're going to put some Botox in here to reduce the size of that, so that kind of in this area, the scalp is going to have a smoother, more even surface to it. So another goal we have, which with addressing the forehead and the eyebrows, is we're going to do an eyebrow lift and give a little bit more curvature to the eyebrows. So we're hoping, that we can kind of raise the eyebrows, give a little more curve, kind of something like that when the Botox kicks in. All right, so as we begin this treatment, I've placed marks. These are just some guides for me of where I want to place the Botox to get the desired effect that we want. Alright, so next what we're going to do is we're going to address under the eyes. And so we're going to look at addressing this area in here. And what she's starting to get the fine lines under the eyes. And if you just close your eyes tight, we're going to see how these kind of bunch up right in there. So we're going to do some Botox there to relax that. And then we're going to do the lips. And with the lips, the idea is we relax the muscle a little bit, and the lips are going to plump subtly. So this is a subtle lip enhancement. They're not going to go huge or anything like that. They're just going to look just a slightly bit fuller. So it's a nice option when somebody just wants a little bit more fullness. Alright, so now we're going to address this muscle up here. This is one of the chewing muscles. The other muscle is down here, which that's also addressed. And she's a clencher, and this muscle is enlarged, from the clenching. We're going to address this one. This muscle here can also be addressed for clenchers, to reduce the force on the teeth or even jaw pain. And so we're going to address this. And this is pretty kind of straightforward. Sometimes it has kind of some Rice Krispie sounds to it. So we're going to do 3 areas here. On the side. There's that. So we'll do this side over here. Clench for me. Okay, just relax. A little pinch here. Alright, so we got done, and it went really well from our standpoint. We did pretty much a full face treatment. There are some areas we didn't address, where Botox can be used. Some of the area can be used down here along the lower jawline and chin, but she's not really a candidate for that at this point. But how'd it go for you?
It was good. These right here were a little pinchy, and the ones around my lips, but the other ones were fine.
Yeah, so lips are a little pinchy, because they're lips. And, with the muscles up here, They can also kind of have like some Rice Krispie sounds as we do that. And with Botox, it takes, roughly 2 weeks to fully kick in. And so we'll have her back, in a couple weeks, see how everything has settled in, see how she likes it, and we'll go from there. Alright, so it's been a couple weeks now since we did our Botox, and it's all kicked in. So what do you think of it so far?
Good, I like it.
You like it? So as a review, we addressed several areas on the face. We addressed in between the eyebrows, we did around the nose, we did around the eyes. We even did up in this chewing muscle, which I can tell that chewing muscle has kind of shrunk down a little bit. It's not quite as prominent as it was before. Right, so it now gives this side of the face a more feminine look with that. And we also did the lips. And right, there's a subtle lip enhancement with that. It doesn't make anything big, but it does make the lips kind of feel and move a little different. What do you think about that movement?
Yeah, that was a little bit awkward at the beginning because it was just a funny feeling.
Yeah, so some people don't mind that, other people don't like it. So it's just something to be aware of, but you don't know until you try.